Your liver is the most silent organ in your body, and I mean that in the most medically serious sense possible. Your heart tells you when something is wrong. It races, it aches, it skips beats. Your lungs protest with breathlessness and cough. Your kidneys send signals through swelling and fatigue and changes in how you urinate. But your liver has almost no pain receptors. It cannot tell you it is in trouble. It can lose more than half its functional capacity and produce no symptom that you would recognize as coming from your liver at all. It just quietly degrades, year after year, until the damage reaches a threshold that the body can no longer compensate for. And by that point, the options are dramatically more limited than they would have been years earlier. This is why liver disease, particularly non-alcoholic fatty liver disease, which now affects somewhere between 1/4 and 1/3 of all adults, is so consistently caught late. Not because the warning signs don't exist, they do, but because they are so diffuse, so easy to attribute to other causes, so unremarkable in isolation, that most people never connect them to their liver until the connection is impossible to miss. I've spent 13 years in emergency medicine watching patients arrive with advanced liver disease that had been building in plain sight for a decade. Cirrhosis that began as fatty liver that was never detected. Liver failure that followed years of abnormal blood tests that nobody acted on. And almost every single time, when we look back through history, the signals were there. Subtle, easy to dismiss, but there. Hi, my name is Dr. Miles, emergency medicine physician with 13 years of frontline clinical experience. I want to walk you through 6 early warning signs that your liver is under stress, what is actually happening physiologically when each one appears, how to distinguish a normal variation from something that needs medical attention, and what to do if you recognize yourself in any of these descriptions. Because early detection of liver disease changes the outcome profoundly. Late detection almost never does. Sign number 1, persistent fatigue that sleep does not fix. This is the symptom that appears earliest in liver dysfunction and is the most consistently overlooked, precisely because it is so common and has so many possible explanations. The fatigue of early liver damage is not ordinary tiredness. It does not resolve after a good night's sleep. It is present in the morning before the day has made any demands on you. It is disproportionate to your level of activity. Tasks that used to feel effortless now require noticeable effort. Concentration feels harder. The motivation to do things that normally interest you becomes reduced. Here's what is happening at a physiological level. The liver is responsible for hundreds of metabolic functions, including the regulation of blood glucose, the metabolism of fatty acids for cellular energy, and the synthesis of proteins that transport oxygen and nutrients throughout the body. When liver cells become infiltrated with fat, the earliest stage of fatty liver disease, their metabolic efficiency falls. The liver's ability to regulate energy metabolism is impaired. Mitochondrial function within liver cells deteriorates. The entire body's energy economy is subtly disrupted. At the same time, a damaged liver produces elevated levels of inflammatory cytokines, signaling proteins that are part of the immune response to cellular stress. These cytokines circulate throughout the body and have a direct effect on brain chemistry, producing the profound, whole-body fatigue that is characteristic of inflammatory conditions. It is the same mechanism that makes you feel exhausted when you have a bad infection, except in liver disease, it is chronic, low-grade, and relentless. The pattern to watch for is fatigue that has been gradually worsening over months, rather than fluctuating. Fatigue that is accompanied by any of the other signs in this video. Fatigue that you have started to normalize as just getting older, without any clear medical explanation having been established. Sign number 2, discomfort or fullness in the upper right abdomen. Most people are surprised to learn where the liver actually sits. It occupies most of the upper right quadrant of the abdomen, sitting just beneath the rib cage on the right side. It is the largest solid organ in the body. In a healthy adult, it weighs somewhere between 1.4 and 1.6 kilograms. When it becomes inflamed or enlarged, it makes its presence known in a way that most people do not immediately identify as liver-related. The sensation is typically described not as sharp pain, but as a dull ache, a sense of pressure, a feeling of fullness or heaviness in the upper right abdomen. It may be more noticeable after eating, particularly after a fatty meal, because digestion increases blood flow to the liver and amplifies the sensation of inflammation. Some people describe it as a vague discomfort, under the right rib that comes and goes without an obvious trigger. The mechanism is straightforward. The liver is encased in a fibrous capsule called Glison's capsule. The capsule itself contains pain receptors. When the liver enlarges from inflammation or fat infiltration, it stretches that capsule, and the stretch registers as discomfort. The liver tissue itself feels nothing but the capsule does. The distinction that matters clinically is this: occasional, brief discomfort after a particularly large or fatty meal is usually benign. Persistent, recurrent discomfort in the upper right abdomen that has been present for weeks or months, particularly in someone with known risk factors for liver disease, elevated body weight, insulin resistance, significant alcohol intake, or a history of abnormal liver blood tests, is a signal that warrants investigation with an ultrasound and blood tests. Sign number 3. Changes in skin and eyes. The yellow nobody notices. Jaundice, the yellowing of the skin and the whites of the eyes, is the liver symptom that most people know about. What most people do not realize is that by the time jaundice is obvious and unmistakable, liver function has typically deteriorated significantly. What matters for early detection is the subtle, early-stage yellowing that most people miss entirely. In early or mild jaundice, the yellowing of the whites of the eyes, the sclera, is often the first visible sign. And it is frequently so slight that it requires looking carefully in good natural light to notice it. The skin may take on a very faint yellowish or sallow hue that is easy to attribute to lighting, tiredness, or simply how you look. The mechanism is bilirubin accumulation. Bilirubin is a yellow pigment produced when the liver breaks down old red blood cells. A healthy liver processes bilirubin and excretes it through bile into the digestive system. When liver cells are damaged and their processing capacity falls, bilirubin begins to accumulate in the bloodstream. As levels rise, it deposits in tissues throughout the body, most visibly in the whites of the eyes, which have a particular affinity for bilirubin, and in the skin. The important distinction is between obstructive jaundice, which can come on relatively quickly and has specific features, and the slow, subtle bilirubin elevation of progressive liver cell damage. If you or someone around you notices a yellowish tinge to the whites of your eyes that was not there before, particularly in combination with fatigue or abdominal discomfort, that is not something to wait and watch. That is something to have investigated with liver function blood tests immediately. If this video is giving you a framework for understanding what your body may have been trying to tell you, I want to ask you to subscribe to this channel right now. I make these videos because the gap between what people know about liver disease and what they need to know is enormous. And narrowing that gap before the emergency department becomes the first conversation is exactly what this channel exists to do. Hit the subscribe button and let's keep going. Sign number 4, changes in urine and stool color. This is one of the most reliable early indicators of liver dysfunction that requires no medical equipment to detect, just knowing what to look for. Urine that becomes persistently darker, a deep amber or brown color, rather than its normal pale yellow in the absence of dehydration, is a sign of elevated bilirubin being excreted through the kidneys. When the liver cannot process bilirubin efficiently through its normal bile pathway, the kidneys take over some of the excretion burden. Bilirubin in the urine turns it dark. This is sometimes described as the color of cola or strong tea. Simultaneously, stools may become paler than normal gray, clay-colored, or unusually light because stercobilin, the compound that gives stool its normal brown color, is derived from bilirubin processed through bile. When bile flow is reduced or interrupted by liver damage, less stercobilin reaches the stool. The color fades. Together, dark urine and pale stools are a specific combination that points directly at liver or bile duct dysfunction. Either one alone might have other explanations. Both together, particularly alongside fatigue or any other sign from this list, should prompt an urgent medical evaluation. This combination can also indicate obstruction of the bile duct, which can have several causes, some of which require prompt attention and should never be left to monitor and see. Sign number 5, itching skin with no rash. Unexplained itching, particularly widespread itching that has no visible skin cause, no rash, no hives, no insect bites, is one of the most consistently underappreciated early warning signs of liver dysfunction. And it is one of the most frequently misattributed, diagnosed as dry skin, allergies, or a dermatological condition when the origin is entirely hepatic. The mechanism involves bile salt accumulation. When the liver's ability to process and excrete bile is compromised, bile salts, components of bile normally directed into the digestive system, accumulate in the bloodstream and are deposited in the skin. Bile salts in the skin directly stimulate itch receptors and nerve fibers, producing a persistent, often intense itching sensation that responds poorly to antihistamines or moisturizers because the cause is internal, not external. There is also a secondary mechanism involving elevated bilirubin in the skin, which contributes to nerve irritation and itch. In some patients, itching precedes visible jaundice by weeks or months, making it one of the earliest signs of liver-related bile processing failure. The pattern to recognize is itching that is widespread rather than localized. Itching that has no visible skin changes. Itching is particularly intense at night. Itching that does not respond to standard treatments and has been present for more than a few weeks without a clear explanation. In the context of any other liver warning signs, this combination warrants liver function blood tests without delay. Sign number 6. Unexplained weight changes and loss of appetite. The liver plays a central role in regulating appetite, metabolism, and the storage and release of energy. When liver cells are damaged and their function is compromised, these regulatory roles are disrupted in ways that produce visible changes in body weight and eating behavior that most people never connect to their liver. In early fatty liver disease, some people experience unexplained weight gain, particularly in the abdominal area, because impaired liver function disrupts lipid metabolism and fat distribution. Others experience the opposite, progressive, unexplained loss of appetite and weight loss as liver inflammation advances and the production of appetite-regulating hormones is disrupted. The loss of appetite in liver disease has a specific character. Food, particularly fatty food, loses its appeal. The thought of eating feels unappealing in a way that is qualitatively different from ordinary lack of hunger. Nausea, particularly in the morning or after eating, may accompany it. Some people develop a feeling of fullness after very small amounts of food, early satiety, because an enlarged liver physically reduces the space available in the abdomen. The liver also synthesizes albumin, the primary protein that maintains oncotic pressure and keeps fluid in the bloodstream. As albumin synthesis falls with progressive liver damage, the body's ability to maintain normal fluid distribution is impaired. Muscle wasting can begin because the liver's impaired function reduces the body's ability to synthesize and recycle the proteins that maintain muscle mass. The person may appear to be losing weight from muscle while simultaneously retaining fluid in the abdomen, a combination that signals advanced liver dysfunction. Any significant, unexplained change in appetite or body weight that has persisted for more than a few weeks, particularly alongside fatigue, abdominal discomfort, or any of the other signs discussed in this video, needs to be evaluated with liver function tests and an abdominal ultrasound. What to do with this information? The common thread running through all 6 of these warning signs is that they represent the liver's metabolic and synthetic functions failing in ways that manifest throughout the body, in your energy, your digestion, your skin, your urine, your appetite, and your weight, long before any dramatic or obvious liver symptom appears. None of these signs in isolation confirms liver disease. And recognizing 1 or 2 does not mean your liver is failing, but they are signals, and signals from a silent organ that cannot speak for itself deserve to be taken seriously. The investigation starts with a liver function blood test, a standard, inexpensive panel that measures enzymes including ALT and AST, which leak into the bloodstream when liver cells are under stress. An abdominal ultrasound can directly visualize the liver and detect fat infiltration, enlargement, or structural changes. These 2 investigations together give a picture that no physical examination alone can provide. If you have recognized 2 or more of these signs in yourself, particularly if they have been present and worsening over months, please make an appointment with your doctor and ask specifically for your liver function to be checked. Do not accept reassurance based on how you look or how healthy your lifestyle appears to be. The liver does not reflect lifestyle on the outside. It reflects it in the blood. Your liver has been working in silence for your entire life. It deserves the chance to be heard before the damage becomes irreversible. If this video helped you understand your body's signals in a way that it hadn't before, please subscribe to this channel and share it with someone who needs to hear it. Early detection of liver disease is the difference between management and crisis. That difference starts with knowing what to look for. Thank you for watching.